Hello everyone, hope you all are doing good. Today we are going to study about halitosis. Halitosis एक बहुत कॉमन ऐसी कंडीशन है जिससे ऑलमोस्ट हम सब बहुत परेशान होते हैं एंड दिस इज़ नथिंग बट बैड ब्रेथ. सो वी ऑल हैव एक्सपीरियंस दिस वंस इन आवर लाइफ टाइम व्हेन आवर माउथ इज स्मेलिंग वेरी वेरी बैड. मोस्ट ऑफ द टाइम्स क्या होता है, मे बी हमने अनियन गार्लिक ऐसा कुछ खाया, दैट कुड बी अ रीज़न, बट मैनी अ टाइम्स दिस बैड ब्रेथ इज़ नॉट एसोसिएटेड विद अ टेम्पररी कॉज. इट कैन बी एसोसिएटेड विद अ परमानेंट कॉज एज वेल. तो अभी हम सब कुछ देखेंगे अबाउट व्हाट इज़ हैलिटोसिस, बैड ब्रेथ, इसे ठीक कैसे कर सकते हैं एंड व्हेन इज़ द टाइम दैट यू हैव टू विजिट योर डेंटिस्ट. ओके, नाउ व्हाट इज़ हैलिटोसिस? Commonly, as I told you, this is said to be bad breath. It can occur because a number of reasons. The one of the most common reason that we have is presence of volatile sulfur compounds. अब volatile sulfur compounds कौन कौन से हो सकते हैं? So your VSCs are basically compounds like dimethyl sulfite. Okay, dimethyl sulfide. Many a times when we take medications, these components are present in it. Then we have one that is known as butyric acid, or it could be your indole. There are many other like these, but mainly they are related to some kind of sulfur compounds only. Okay, next, what is the classification? किस किस तरह की हमारे पास halitosis की complaints आ सकती हैं? Some could be genuine and some could be pseudo. Pseudo is usually related to something that is usually partial, or you can say it is half. Okay, that is what you say as pseudo. Now what is genuine halitosis? Genuine halitosis दो टाइप की हो सकती है. One is physiological and one is pathological. Physiological is something that is very very natural to be there. Okay, pathological का मतलब क्या होता है? जब उससे रिलेटेड या तो वो किसी डिसऑर्डर से रिलेटेड है या कोई ना कोई पैथोलॉजी है जिसकी वजह से वो हो रही है. We will study about this in a minute. Now your physiological could basically be a bad breath that you experience right after you wake up. So usually when we wake up in the morning, so we have this very bad breath. Reason being the low saliva content in the oral cavity at that time, or maybe you have eaten onion or garlic. That could be some of the physiological or genuine halitosis. Coming to the pathological, ओके, वन मोर थिंग यू हैव टू रिमेंबर इज जो आपकी फिजियोलॉजिकल हैलिटोसिस होती है दैट इज़ ओनली गोइंग टू स्टे फॉर सम टाइम. ओके, मतलब कि आफ्टर सम टाइम ऑब्वियसली वंस यू हैव ब्रश्ड योर माउथ और वंस यू आर वोकन अप एंड गॉट रेडी फॉर योर वर्क, इट इज़ गोइंग टू सबसाइड. तो ये सिर्फ एक शॉर्ट पीरियड के लिए रहेगा. पैथोलॉजिकल जो होता है वो आपके थ्रू आउट ओरल कैविटी में प्रेजेंट रहेगा. वो जो स्मेल होती है बैड ब्रेथ वो फॉर अ लॉन्गर पीरियड ऑफ टाइम रहती है. वाई? जब तक आप उस पैथोलॉजी को या उस डिसऑर्डर को आप रिमूव नहीं करोगे तब तक वो कंडीशन ठीक नहीं होगी. नाउ पैथोलॉजिकल जो है उसमें कौन कौन सी पैथोलॉजीज हो सकती हैं? कुछ इंट्रा ओरल और एक्स्ट्रा ओरल हो सकती हैं. अब इंट्रा ओरल में क्या है? फॉर एग्जाम्पल यू हैव एन एब्सेस इन द टीथ एंड यू डोंट नो अबाउट इट. Maybe there is a tongue coating that is present. So many a times we just brush our teeth. ठीक है, हम फ्लॉस नहीं करते, हम टंग क्लीन नहीं करते, उसकी वजह से क्या होता है? टंग के ऊपर कोटिंग बनती जाती है. दैट कुड ऑल्सो लीड टू बैड ब्रेथ. देन नेक्स्ट इज जिंजिवाइटिस. जब बेसिकली आपके जो गम्स हैं उसमें इन्फ्लेमेशन है, अगर आप टाइम टू टाइम स्केलिंग नहीं करवाते हो या टूथ क्लीनिंग नहीं करवाते हो, दैट ऑल्सो कुड बी अ रीज़न ऑफ योर halitosis. Next is periodontitis. When basically periodontitis is nothing when your gums are bleeding. So if you're brushing or you're eating something and your gums are seriously bleeding and you're not going to your dentist, तो उसमें क्या होगा? धीरे धीरे it is going to combine in and result in halitosis. Next what you have is dry mouth. Dry mouth condition, all the dentists out there, you must be knowing this is also said as xerostomia. Now these were the intraoral causes which are inside the mouth. Now we'll talk about some extraoral causes that are usually there in the body. So for example, a person is suffering from any kind of liver disease, GERD, that is nothing but gastric esophageal reflux disease. Okay, when the HCl is coming basically backwards into the esophagus, that is what you say as GERD. I have made a video on this also. Now, if a person is suffering from any lung disease, diabetes, or any ENT condition, or maybe if the person is alcoholic or a smoker, then also halitosis can be experienced by that person. So this was about the genuine halitosis. And what is pseudo halitosis? Pseudo halitosis का मतलब होता है when there is no genuine halitosis present and the patient is just having this thing in his mind, सिर्फ उसके मन में है कि यार there is a bad smell coming from my mouth. So in that conditions, if you tell the patient about your diagnosis that no, you are not having any particular halitosis issue, he is going to trust you. That is what you say. Okay, moving ahead, what are the different diagnostic tests which you can do to diagnose that if you have halitosis or not? Now this is something anybody can do, no matter you're a dentist or not, you can do this at home as well. So this is the first test, that is known as organoleptic rating. Now organoleptic rating में आप क्या करते हो? You are going to smell the patient's breath. I know it's a kind of cringe thing happening, guys, but this is what you are supposed to do. Okay, you have to smell and rate the patient. So that is the most easiest and the cheapest method of checking someone's bad breath. You are supposed to smell it, and when you smell it, accordingly you can rate. According to this grading, you are going to rate the patient. So for example, if there is no halitosis, rate him as 0. If there is one barely noticeable, say it 1, slight is 2, moderate is 3, strong is 4, and severe is going to be 5. This is how you're going to rate the patient. Okay, this is considered to be a gold standard test. That means the easiest and the most accurate one. Other than that, we also have something known as halimeter. Halimeter is nothing. This what you see in the picture is halimeter. So you see this man holding a device and he's having this tube kind of structure which he is putting in the patient's mouth. This will actually show you the number or the severity of your halitosis. Then you have something known as oral chroma which can be done. Saliva incubation test could be done. Then the very common, हम सब ने नाम सुना, and mostly in the chair side viva they do ask about the most common test, that is the Bana test. It is the most common chair side test. Okay, remember, it is the most common chair side test. What you usually do in this, you have got a Bana kit like this, that is going to have a strip in which you put the patient's saliva sample, और उस सलाइवा सैम्पल को फिर ये जो आप मशीन देख रहे हो ना, बाना टेस्टिंग मशीन, इसमें आप रखते हो, एंड देन यू कम टू नो अबाउट द हालिटोसिस. Then the last one is the ninhydrin test, that is usually done to check the presence of polyamines. Okay, these are the different type of tests we can do. Now how can we manage halitosis? And this is not just a question for dentist out there, but normally भी आप bad breath को कैसे manage कर सकते हो? So first and very most important is proper brushing. Okay, proper brushing, maintaining your oral health, also flossing at times can help you with this condition. Other than that, proper tongue cleaning. Most of us are forgetting this. We don't clean our tongue, and as I told you, the tongue coating is a major source or responsible for your halitosis. Next, what are the other treatments? Like for example, as I told you, there could be extraoral causes as well. If you're suffering from a lung disease and you're not getting it treated, so that can also lead to bad breath. So what you have to do is, अगर किसी भी टाइप का और कोई डिसऑर्डर है बॉडी में अदर देन द डेंटल डिसऑर्डर, देन गेट दैट ट्रीटेड. ओके, that is the second thing you have to do. Then now coming to the chemical needs. Chemically, there are mouthwashes which are the chlorhexidine mouthwashes or the betadine mouthwashes. Commonly, very easily, they are available at a chemist. You just go and ask for a chlorhexidine mouthwash. Never use these mouthwashes in a concentrated form. Always dilute them and then rinse your mouth with them once or twice, and that can help you a lot. Last is going to be masking the malodor, that is fooling people around you. And most commonly, how you can do this? By using chewing gums or mouth sprays, lozenges, or at times you can use mints. Also there are these sprays which could be used. Okay, this is what a chlorhexidine mouthwash looks like. This is by the brand Chemfresh. So you can use this Now this is the chlorhexidine, and now you add water here this much, that is going to get diluted, and then you can rinse. Okay, then you have lozenges which will help you. Mouth sprays are also very easily available. These paper strips are also available. इन सब चीज़ों से आप क्या कर सकते हो, माल ऑर्डर को मास्क कर सकते हो. You can basically fool out people around you, and that is all about halitosis or bad breath. It is a very common condition that you're going to see patients with, and treating this is also very easy. Okay, I hope the video was useful to you. Please like, share and subscribe. Thank you so much.